I'm Tony Bach, one of the founders of Vital Talk. Thank you for clicking through our communication skills portal to this first step. I know that many of you have been taking care of patients with a serious illness for quite a while, and so it says something about you that you would take the time to click on this video to improve. Because it turns out that the way we were trained to do this work wasn't actually the best way, and it's taken me a while to figure that out. You know, I've been a medical oncologist and a palliative care doctor for, a couple of decades now. And when I started as a medical oncologist, there was nobody to tell me or explain what the best way to talk to a patient about the fact that their cancer was back, the fact that they couldn't be cured, the fact that they really needed to make some plans. And so I really learned the hard way by trial and error. And watching other physicians develop now, I can see that this trial and error process, while it is time-honored, is incredibly inefficient. And I am hoping that this video and this pathway can help you accelerate through this pathway a lot faster than I went through it. One of the moments that made me realize that there was a lot more to communication and a lot more to what patients' experiences were was a funeral that I went to after one of my longtime patients with metastatic colon cancer had died. I went to the church with a little bit of trepidation. It turned out it was 10 minutes from the hospital where I worked, but it was in a neighborhood that I'd never been to. It was a really vibrant congregation. They were singing. Everybody obviously knew this patient. There were loads of tributes. And while they were very gracious to me and grateful that I had come, I actually found myself kind of embarrassed. They were talking about parts of this woman's life that I had no idea about. And I realized I had been missing out on some parts of this woman's life that were incredibly central to how she lived, faith, her family. Boy, I just thought, what have I been talking about? It was one of the moments that made me realize how important it was to separate what my patients were concerned about from what I was concerned about. I cut my teeth as a young oncologist on bone marrow transplantation. There were a group of patients that would risk anything to be in our studies, including death, and we would take them to extremes. And I was implicitly taught that that was the template for how a good patient should be and how I should be as an oncologist. That good patients were ones who were willing to risk everything, and that I was a good oncologist if I was willing to push them to the absolute limit. What I've learned since then is that there is a wide variety of what patients value and what patients are ready to undergo for the sake of having a little more time. And I've become much more tolerant in how I think about them. It's really opened up my practice and actually given me a great deal of satisfaction to see how I can meet patients where they are and feel like I'm doing the right thing. Because nobody really seemed to know how to communicate when I started in this business, my colleagues and I have combed the psychological literature to figure out what really works. And there are a couple of things that I wanted to recommend to you to try right now that you can use as kind of your starter kit in building a better toolbox for communication skills. The first thing is to prepare yourself. Take a minute before you go into the room. It won't take more than a moment to take a sticky note, draw a line down the center of it, and write on one side, here's what I'm concerned about, and on the other side, here's what I think the patient is concerned about. I would have found in my early days that I would have known a lot about what I was concerned about, but I wasn't so good at knowing what the patient was concerned about. And this is where your colleagues can help. The bedside nurse will often know something. And the question that you can ask to get this is, what do you think they're most concerned about? I used to ask, how are they doing? Are they ready for a talk? The better question is, what are they really concerned about today? The second tool that I want to add to your toolbox is about assessing what the patient knows right at the beginning of the conversation. I used to get all wound up with my agenda, have 4 things that I wanted to talk about, and I'd go in and blurt them right out. patient would go, very politely, and at the end of it, they'd be asking the nurse, after I left, what did he say? To avoid that, which turns out is just frustrating. It's a waste of your time, it's a waste of their time, and it leads to this kind of mistrust because they're not sure what you're talking about. The way you can avoid that is to ask, what have the other doctors told you? What were you hoping to talk about today? You may feel like you're giving away the agenda, and you're really not. What you're really doing is finding out where your patient is starting from, because that starting point will tell you where you should go next. The third skill that I'd like to add to your toolbox is to say to the patient at the end of the visit, what's the biggest thing you're taking away from our conversation today? It's really interesting because it's like instant feedback. You can tell exactly what landed and exactly what didn't land. It can help you start to see when you're connecting and when you haven't connected. At that point in the conversation, it may be too late for you to do much. It might be that you just have to go and move on to your next patient and realize what you have to do. You can go back and correct things, but really think of this question as a feedback analysis for yourself. These three skills can help you get a jump start on things. Prepare yourself, assess what the patient knows, ask them at the end what they're taking away. And then there's some really simple steps you can take to go to the next step. If you're part of a hospital or an institution that is a member of the Center to Advance Palliative Care, there's some great short communication courses that you can take in their online curriculum. Each one of them probably takes 10 minutes or 15 minutes, and they're great snapshots of skills that will really help you in a pinch, and it'll give you a sense of what you know and what you could improve on. The second thing you can do is go to the VitalTalk website at vitaltalk.org and look at some of the videos in the areas that you're most concerned about. When I'm talking to patients about living with a serious illness, I'm always thinking about what's the information I have to disclose, often bad news. How do I start to understand the patient's world and their values, what's really important to them? How do I translate those values into an actionable care plan? And then finally, how do I engage them in that care plan? Sometimes I have to make a recommendation. Sometimes I just need to ask patients what they think the next step should be. All those skills are illustrated in some great short videos that are totally free that you can come back to and again and again. And there's some handy conversation talking maps that you can download and use, or download onto your smartphone and use, because we have an iPhone app and an Android app. So check out the other steps in this pathway, but remember that there are a bunch of resources that you can use right now, just in time, when you're about to have another difficult conversation. Think of it as sharpening the saw. That's what one of my friends calls this kind of education. It turns out that your training probably didn't prepare you for these conversations very well, but we've taken the best of what's out there and condensed it into a bunch of bite-sized pieces that you can start on. When you're ready later, going to a face-to-face course is an amazing way to boost your skills. You will find that being with other people who are working on this is an incredible learning experience, and in many ways the most powerful way to change how you are with patients. The work we do is so important and potentially so satisfying. What I see now in the world is a lot of frustrated doctors, a lot of frustrated patients, and honestly, it's a recipe for burnout. So thank you for the work you're doing. Take care of yourself, and think about what you could do today in just a few minutes to jumpstart your communication skills. I'll see you later.